Hello everyone, so here we are back again today with the Healthcare Dialogue series. In this episode, we are delighted to have a conversation with Dr. Stephan Chan. He is an anesthesiologist and pain physician at Tan Tong Seng Hospital. And he's also the Chief Medical Informatic Officer for Woodlands Health Campus. He's also part of the leadership team for EPIC implementation in multiple institutions in Singapore. We're all aware that Woodlands Health Campus in Singapore will be pioneer in the use of tech for patient care. The team is bold in the adoption of smart technology, automation, and IT innovation, and is incorporating these in its design of the new campus. The facility is due to open its door for operations from 2022. So to start with, digital transformation was anything but mainstream before COVID-19 pandemic kicked in. When Woodland Health Campus was put into design phase, certain pathways, processes would have been created. But now that COVID has shaken up the whole healthcare sector entirely, we have a different world that we are living in, which I'm sure Dr. Chan, you would agree. And the ongoing pandemic has accelerated the speed of transformation that we are witnessing currently. In light of that, what transformational changes were introduced, or how have you modified your processes or pathways to embed all these new ways of working in the new Woodlands?
Thanks. I think it's important to remember that all changes, whether the more gradual process modifications or the more exponential innovation transformations, should be rooted in patient needs above anything else. And we have taken that to heart. Our Woodlands staff are embedded in operational hospitals such as Tan Tock Seng and Yishun Health Campus. And so they have been right in the thick of all the changes made to our ways of working in healthcare. And I'd just like to maybe spend a little bit of time in each of the areas I think are significant. The first would be administrative changes. These were largely related to work from home and the need to maintain business continuity in order to continue to provide care for patients. Because healthcare is an industry where our care never truly stops. And for us, virtual meetings have become a standard fixture, and we now have access to intranet applications remotely too, to continue doing the work that we used to need to go to the hospital for. Clinically, I think everyone is aware, teleconsultations have increased significantly, and not just video-based consultations, but also phone-based ones. Many of our clinical teams are also now looking at streamlining the entire patient journey, especially in the outpatient space. So they're looking at redesigning the workflow so that asynchronous activities can be remotely completed before the patient comes to hospital. And then previously disconnected face-to-face encounters, maybe that took place over a few sessions or in different locations, can be consolidated and efficiently and effectively carried out. I think the last big area for me in terms of how we've changed is it's to remember that the well-being of staff are even more important in this highly irregular and stressful time. So we have split work teams, and because of that, there is this encouragement from the leadership team to get more frequent and regular team bonding activities up and tap onto informal communications so that we still manage to stay in touch emotionally with one another. Support networks have been set up with comprehensive training kits for the support leads to help staff who are facing difficulties. And of course, there is a big shift towards virtual training and education to maintain staff currency.
Great. I think, as you mentioned, talking about the well-being of the staff and in the current the virtual world, when we are not seeing each other as often as we would see each other in normal circumstances, it is key that we still maintain that communication, that level of conversation ongoing to make sure all your staff are motivated to drive in the productivity as expected, and that's not affected. due to the current ongoing pandemic. So that's well said. That takes me to the another question that we have is, there is an acceleration on digital adoption that we've addressed that question. And in light of how COVID crisis has augmented digital technology roadmaps around remote monitoring, virtual care, and telemedicine, as you just said, what are the lessons learned for sustained innovation? How do you sustain this innovation even beyond COVID?
Yeah, that's a really great question. You know, innovation is so often short-lived. It's really difficult to sustain. Um, I think what I learned is that innovation never occurs in a vacuum. It always needs a need. And have you heard of the term burning platform? So the origin of the term comes from a story about a man on an oil platform in the North Atlantic Sea. And one night he's woken up by an explosion and finds himself in the midst of a blazing fire. So he's faced with two options: stay on the platform and be engulfed by a certain horrible death, or jump more than 30 meters into the freezing waters of the sea, where he might die within minutes from exposure. And I think the motto here is probably better to have um, possible death than certain death. And this is linked back to innovation in the sense that wherever possible, we want to look for the burning platform where everyone recognizes that doing something, no matter how the previous experience was, or despite previous failures, is always better than doing nothing. And in this case, we have our burning platform, and that would be, maybe we can call it the roaring pandemic. And that was what was needed to push healthcare onto an accelerated path of adopting new practices and mindsets to transform healthcare in a sustainable manner. And, you know, I think the point I'm trying to say is without trivializing the pandemic or sounding trite, that's not intention, but for innovators, you should always be open to opportunity and never waste a good crisis.
Great. And
So that's, I think, the first point. Really take advantage of this scenario. And I think the second one I want to say is we've learned that systemic changes are what is required for sustained innovation. It's never just about single area. It's not about technology alone. It's not about the innovator alone. So in terms of teleconsultations, previous attempts were not as successful as we like. We never got it becoming mainstream the way it is now. And that's because we didn't have our financing, training, education, accreditation, legal, and clinical operational practice all aligned. COVID gave us that push. So now we have financing being approved for teleconsultation use cases where previously they did not exist. Even the charges are at parity, meaning they're the same rate as in-person services. We have virtual modules for familiarizing and training care providers on how to deliver care appropriately through teleconsultations. And on the legal and practice front, I'm sure there will be a revision of our existing regulations and guidelines for hospitals, clinics, telehealth, even the ethics guidelines, as well as impact on the sandbox that we have now for telemedicine providers.
great. I actually like the example that you gave in the beginning of your answer, which is so apt. Quite often we do limit ourselves or limit our thinking that innovation is limited to technology adaptation or technology transformation, but innovation could also be in the form of thinking in terms of practices, strategies applied, processes redesigned. It's not always limited to technological transformation, but it's also the change in the mindset of the healthcare leaders. And I totally agree that. And as I said earlier, that technology or telehealth for that matter of fact, and as I've spoken to others as well in the industry, where it took them years to come where they are today, and COVID just gave that push that was required for the, and it was at the time where this seemed the only option. So
Yeah.
Technology back then was anything but mainstream. So I'm sure that's the positive side of the COVID, and that prepares us for any future health crisis, God forbids if there are any. With that, I'd like to go on to the next question that we have for you is your thoughts on the need of creating an innovation culture that enables you to design, test, implement, and scale digital services at breakneck speed. Bearing in mind our current experiences from COVID, what is that is sort of a learning that you will take from your experience right now to make sure that you're able to design, test, and implement digital technologies or services at breakneck speed, if at all, as I said, God forbids, a future health crisis is in store for us.
I think I think what stands out in your question is breakneck speed. And it's very difficult to implement change and innovation. Um, and we all have experienced that. In the innovation area, I would say probably 90% or more of the activities that I have to do would be related to change management. So I've been experimenting more with smaller agile teams. And I think there's a lot of relevance to how the COVID virus spreads too. So um, it is maybe very opportune to talk about this. So smaller agile teams that help to drive the innovation culture, or maybe any other sort of culture for that matter, are teams that are smaller, that meet very frequently, that are embedded in an existing operational model, and that is how they spread the innovation culture. So first, I think it's about the member composition. Members of the team that are innovating, they need to be part of the real world. So as far as possible, I like to embed them in the actual department that they're assisting or in the actual area. So for example, a population health agile team will need to have members from the population health department, and they are actual practitioners on the ground that have multiple contacts with the working environment, the patients, caregivers, and staff. So they are the ones that spread the virus. They have to go out and spread the culture. You cannot have an innovation team that is isolated in an office building all by themselves without contact with the ground. So you don't get that spread once you're isolated. And I think the next key ingredient in this agile team is that they have to be very virulent. And the analogy for that in a technical team is they have to be very competent. The solutions they come up with to solve problems, they have to be very knowledgeable, able to understand the business needs, and then suggest something that works. Um, and that is the way the virus has, well, sometimes has to adapt, become more adept at surviving. Um, Surprisingly, now it's starting to have less mortality. And again, that is that rapid iterative cycle that even the virus goes through to adapt to the changing environment. And for the agile team, using that analogy, they meet weekly, both internally and then with the business users to iterate, to generate something that works better, sticks better, spreads better when they release it to the teams that are on the ground. And I'm not sure whether that helps, but I think that's really key to having innovation spread, to really embed the innovation units within the business units of the organization.
Very well said. I totally agree with you. And with that perspective in mind, because you're practicing as well, I wanted to ask, apart from, since we've spoken a lot about digital transformation and technology, and when we are talking about patient experience per se, in your opinion, what is that one element, if you were given a choice or an option to redesign the service experience from the patient's perspective? What is that one element that would you recommend should be redesigned or rethought or reimagined in order to make it uh, extremely exceptional for the patients from an experience perspective?
That's an interesting question. Just one. Yeah.
Yeah, just one. Or you have couple, we don't mind you sharing
I
that.
think I think it's good to choose one.
Yeah.
So it makes us prioritize. Um, Again, I would like to say, it's not about technology, it's not about innovation. I think the most important thing in redesigning the patient experience would be empathy. And I think it's very, very important. It really needs to start with the hospitals, the staff, the care providers, understanding what is important to the patient and to the caregiver. And we are brought up very differently. If we have not been patients, we don't understand. Uh, if you walk around, you'll see that we are so busy with what we have to do for the patient that ironically we have forgotten what they really need. And the healthcare arena is full of unmet needs, and a lot of this can be very, very important to the patients. As an example, if you walk into the inpatient ward and you say, okay, what is important to the patients? I mean, obviously, standards of care, safety, quality is important. Okay, but in a typical hospital, if you go in and you ask the patients what they want, they actually want things like, oh, they want a taste of their favorite food, they want to listen to their favorite music, and etc. Right? And they say hospital food sucks, as an example. So that is maybe a more less clinical example, but I think the analogy is transferable. To really be able to redesign the experience, we have to put ourselves in the shoes of the patient, and that I think would be the single most important thing that we have to embrace in order to be able to redesign appropriately for the patient instead of redesigning for the organization or redesigning for the staff experience, maybe. Those are important and they need to be layered on. But if we want to do it for the patient, then we need to be channeling the patient. Not everyone is able to do that. Obviously, there are experts who can help. So if it's difficult, we can always look to patient user experience experts or human factors engineers, or even reach out to resources in the community to get patient representatives to come in on the design team, and that would be very helpful.
Great. Yeah, I agree. And quite often, patient experience is not complex. And I think what the patients prefer is to make the experience simple for them, to make it seamless. Sometimes we are looking at a bigger picture. We are looking at a picture not from the angle or not from the eyes, not through the eyes of the patients. As you said, that the simple desires are maybe they don't like the food in the hospital, and the management has been concentrating on different metrics to measure patient experience. It is very important to measure the right thing in order to understand the pain points as to why the patients are not experiencing the care experience that they should be. And when you talk about conveying empathy, adding that human touch while dealing with the patients, we are in the virtual world right now where everything, we are working from home, telehealth has taken an uptake. How do you convey empathy in the virtual world?
Oh, that's a tough question. I think it's a whole new world. We are taught bedside manners, and we don't have any idea how to translate that to the online setting. So as an example, when we first started virtual conferences, everyone didn't know how long to stop talking before interrupting. No, everyone didn't know how long to wait before interrupting, or when there was no one saying anything. All these cues that we normally have face to face are all gone. And so it was a lot of learning. For some, it was easier, but for many, it was hard. Um, I think I think tone expression helps. Although there are many of on our teams who are shy and sometimes they don't like to show their faces, but it helps. And to be able to recognize human emotions is good. Although, if there are too many faces on the screen, then it's also very difficult to continuously look at so many faces and interpret emotions. So we do have to balance that. Another way is to have some sense of familiarity, meaning everyone is used to chatting online using messaging and emojis, and sometimes transferring this to the meeting environment allows everyone to have a sense of, okay, how does the other person feel, and maintaining that maybe less sterile, cold touch. And I am
Exactly.
using these examples from the work from home environment. Now for patients, I really think it's something so new. We do have to spend a little bit more time to see what works. I think first off, I would say every patient is different.
True. Yeah.
I sometimes have phone consults with my long-term patients, and that's because they are disabled, unable to move, in a lot of pain. And for those patients, even the voice nuances you could pick up very easily, and you do understand because there's a relationship. Where the relationship is shorter, then having video, having a longer consult time, giving them more time to figure out what they want to say and to clarify any misinterpretations which can occur in a teleconsultation. That's helpful. Um, yeah, and being patient, I think not interrupting, allowing someone to finish their line of thought is very important in giving them the feel that they are being listened to. And then ironically, maybe when we teach our doctors to do that, because they've never been formally taught this kind of etiquette for online meetings, maybe it would improve the patient experience a lot more for for our patients.
Great. That was a great thought put into perspective. And that brings me to the last question that we have for you. You're speaking at our Patient Experience and Engagement Summit next month. And what is that you're most looking forward to from attending or speaking at the conference?
Yeah, I think what's most unique about these experiences, these conferences, is being able to hear from other innovators and from the audience, hearing their questions, their thoughts, and their comments to the questions, their answers to the questions. It shows what people are thinking about, and there's usually a massive synergistic learning from that you will never get from reading an article or reading the textbook. And I think that's what
Sure.
I look forward most to, the human interaction.
Yeah. You learn a lot from people's lived experiences and you gather your inspiration to do your best. Some of the practices that you have heard from your peers in the industry, you may wish to roll them out and check if they were to work. And as it goes, learning never ends, and the practical examples help you a lot more than theoretic. When, of course, when it comes to medical practice, it's more evidence based, but such platforms just give you an opportunity to connect with like-minded people and try to get access to the best practices that's available. So great, that was a real fascinating conversation that we've had. Thank you very much for joining us today.
Thank you.
So to conclude, while we recognize that the tragedy COVID-19 has caused to the world, we also realize that it has opened many opportunities for healthcare sector to rejuvenate in this new normal ecosystem. With that, before I sign off, I urge you all to join us for the Patient Experience Engagement Summit next month, as along with Dr. Chan, we are bringing great minds together to share their stories and provide real-world perspective on bridging the service excellence gap in the healthcare industry. Thank you, Dr. Chan, for joining us today. We hope to see you back again next month.
Thank you.